periodontal disease and how it's affecting your overall health. Today we'll be talking to 3 women who are struggling with this disease every day.
My gums bleed so much when I brush them.
I can't smile properly anymore. My teeth are wiggly, my gums have receded.
I struggle to find anything to eat because I'm afraid my teeth will just fall right out.
Hi, I'm Dr. Amanda Advanced. I've been practicing for well over 25 years. With me today are my colleagues, Dr. Emily Early and Dr. Michelle Moderate.
Hi, I'm Dr. Early, but you can call me Dr. Emma. I've been working as a dentist in the Toronto area for the past 5 years.
Hi everyone, I'm Dr. Michelle Moderate. I've worked on the West Coast as a dentist and just relocated to Toronto, and I've been practicing for about 12 years now.
For those of you who aren't aware of what periodontal disease is, it ranges from gingivitis to 3 stages of periodontitis. Today we will be discussing each case type and the signs and symptoms that go along with each type. We will discuss clinical findings as well as radiographic findings so the viewers at home know what the warning signs are. We will be taking radiographic images on each of our guests to show the different stages. We're going to go to commercial and we'll be right back.
When I saw a little pink in the sink, I thought, I'm just brushing too hard, no big deal. Then the dentist said a little bleeding is a sign of gingivitis and to switch to Colgate Total.
Only Colgate Total has an antibacterial ingredient. It attaches to teeth to form a protective shield that's clinically proven to protect against a complete range of oral health problems for a full 12 hours.
Welcome back! I have Dr. Emma here. I'm going to hand things over to her.
I will be discussing the basics of periodontal disease. The periodontum includes 3 parts. First is the cementum, which covers the root of the tooth and is avascular with no innervation. Second is the alveolar bone, and that is where the roots and the teeth are contained. And last is the periodontal ligament, which is between the alveolar bone and the cementum, which helps support the teeth. Periodontal disease includes gingivitis and periodontitis. Gingivitis is the inflammation of the gingival tissue and is a reversible bacterial infection that is caused by plaque. Periodontitis is an inflammation of the periodontum and is irreversible bacteria infection, and that extends into the connective tissue and alveolar bone. There is attachment loss and destruction of the alveolar bone.
Your dental professional will use a thorough clinical exam in conjunction with x-rays to detect and determine if periodontal disease is present. The earliest signs of periodontal disease are detected clinically, and the radiographs allow the hygienist to document the existence of the disease. Radiographs will remain on a client's record and serve as a reference point to see how the disease advances. So during your clinical exam, your dental hygienist will be looking for things like bleeding, inflammation of the gums, redness, rounded gingival margins, pus, probing depth, and soft tissue lesions. Your x-rays will allow your dental hygienist to see things that cannot be seen simply by looking inside the mouth, such as predisposing factors, the amount of bone present in your mouth, the condition of the alveolar crest, root length, crown to root ratio, any root fractures, root resorption or impactions.
Thank you so much, Dr. Emma and Dr. Michelle. Our first guest today is going to be Caitlin, and she has been experiencing the early stages of periodontal disease. Dr. Emma had a chance to meet with Caitlin earlier today, so we'll discuss her findings.
I met with Caitlin today and we did a thorough exam and took photos and radiographs.
When I brush my teeth, it hurts so much. I just want to give up on brushing. My gums feel swollen. I haven't flossed in years. I dread going to the dentist because they always say I need to do a better job taking care of my teeth. I'm just so embarrassed.
Welcome, Caitlin. Thank you for joining us.
So we took some pictures of Caitlin's mouth, and as you can see, things are fairly normal. Her gums are a bit inflamed and puffy, but once we started probing, we discovered the pocket depths to be about 3 to 4 millimeters. Caitlin's gums are also bleeding upon probing. On the radiograph, there is no evidence of bone loss. Caitlin has severe gingivitis, which doesn't show on the x-ray. We know this because of the bleeding when we're probing and the pocket depths. If Caitlin doesn't change her habit, she is on her way to periodontitis. We showed Caitlin proper brushing and flossing techniques and recommend that she sees her hygienist every 3 months for regular cleanings.
Thank you, Dr. Emma. Caitlin, do you agree to see your dentist every 3 months and start a regular routine of brushing and flossing?
Yes.
I promise to take better care of my teeth and see a hygienist on a regular basis.
We're going to go to commercial and we'll be right back.
I don't have time to floss.
It really hurts. The floss keeps getting stuck in my braces.
My gums bleed.
Look, flossing your teeth doesn't have to be such a pain. Introducing Dr. Hart's Power Floss, the fast, easy, pain-free way to floss every day. Just fill, point, and press to power away plaque and debris in 60 seconds or less. No cords, no batteries, no worries, because the Power Floss is powered by air. Power Floss gets in between teeth to get out what brushes miss.
Receded. I can't go on dates. I can't go out and eat with friends because it's a mess. I can't smile anymore.
Welcome back. Everyone give a warm welcome to our next guest, Kim, who, like many other people out there, suffer from periodontitis. Kim met with Dr. Michelle to discuss her issues.
Hi, thank you, Dr. Amanda, and hello, Kim. The ADA, the American Dental Association, classifies Kim's case type as a severity type 3. So it's a more advanced state of periodontal disease, and it shows increased destruction of periodontal structures, clinical attachment loss of up to 4 millimeters, moderate to deep pockets at 5 to 7 millimeters. She showed moderate bone loss, tooth mobility, furcation involvement, which didn't exceed class 1 in her molars. So when I first met with Kim earlier today, she was presenting concerns of some discomfort. She noticed her teeth were a bit wiggly, there was lots of bleeding when she brushed her teeth. So the first thing we did was a full clinical exam in order to assess her condition. As you can see here on the clinical photos of Kim's mouth, her gums are red, there's inflammation, and her probing depths were between 5 to 7 millimeters. A few of her teeth also had mobility. So next we took a series of radiographs to get a better idea of the extent of her periodontal disease. So on the radiographs, you can see a loss of between 30 to 50% and localized class 1 furcation involvement. This bone loss pattern that you see here is both horizontal and vertical, and in Kim's case, is generalized throughout the mouth, so that means that it's evident in more than 30% of her mouth. This bone loss pattern could also be seen as localized, maybe occurring in just a couple specific areas of the mouth.
Thank you, Dr. Michelle. Kim, do you feel these goals are achievable?
Yes, I just felt like things are spiraling out of control.
Do you have any recommendations for Kim today?
Absolutely. So for Kim and anyone else that might be in her position, we definitely recommend maybe seeing a dentist more often than she currently is. Put her on about a 3-month recall system so we can keep a very close eye on that bone level, make sure it doesn't get any worse, and we can further assess from there and see how it goes.
Dr. Michelle has made me feel like I can stop things from getting worse. I want to see the dentist and hygienist more often so I can stay on top of the problem.
That's great. Thanks so much, Kim, for being here. Thank you, Dr. Michelle. We're going to go to another commercial and we'll be right back.
Polident presents Martha Ray, movie star, denture wearer.
Folks, I've used Polident for years, but now there's something that cleans my dentures even better. It's fantastic. New Extra Strength Polident. Watch it work on this tough lab stain. New Extra Strength Polident has 50% more of a special stain remover. 50% more. Gets those stains clean, even in between. So take it from a big mouth. New Polident Green gets tough stains clean with extra strength.
I have a hard time finding anything to eat, so I mostly eat mashed potatoes and Jell-O. My mom has really bad periodontal disease as well, and she's been on the show before. The dentist really helped her.
Welcome back. Next we have Danica with us, who is so embarrassed of her teeth and gums she barely smiles anymore. We have a clip of Danica's mother who was on our show previously. With the help of my colleague, Dr. Daniela Deep Pockets, we were able to get Danica the help she needs. Dr. Daniela Deep Pockets has been a specialist in periodontal disease for over 25 years. Please give her a warm welcome. Hi, thanks for coming.
Thank you, Dr. Amanda, for the nice introduction. I love to be on your show. I had an opportunity to meet with Danica earlier this week, and I was able to assess her mouth on radiographs. Then I did some periodontal probing, and I found that she had pockets up to 9 millimeters and clinical attachment loss of 5. She also had class 3 mobility on several teeth, which means that those teeth can move in every direction. On the radiographs, you can see severe bone loss in 40% of her mouth. You can also see class 3 furcation involvement in some of her molars. I explained to Danica that she has stage 4 periodontitis, Because of her mother's periodontal history, she has been predisposed to periodontitis. My recommendation for Danica is to see the periodontist every 2 to 3 months to help manage her situation. Danica wants to try to keep her teeth, so she's going to do everything she can to participate in her oral care. I explained to Danica that her teeth aren't the best shape, but we're going to help her achieve this and to keep all her teeth.
You guys don't understand how grateful I am. It's incredible.
It's okay. Thank you. Thanks. This is the first step. Thank you to all our guests who shared their story with us today, and the dentist for taking their time to come in. So we want to stress to those here in our audience and to our viewers at home that periodontitis is not to be taken lightly. We wanted to briefly discuss some of the predisposing factors of bone loss. There are factors in our lives that are within our control that can prevent or arrest periodontitis. Some factors such as smoking, diabetes, or poor oral self-care can greatly increase your chances of developing periodontitis. However, there are other factors not within our control that can cause increased risk for disease development, such as hereditary periodontal disease, age, race, gender, or genetic disorders. It is important to see your dental professionals for detection, prevention, and monitoring to ensure your oral health is in best possible condition it can be. We are going to thank our doctors as well as our courageous guests for being on the show. I hope you all enjoyed today's show where we discussed periodontium and what periodontal disease and identified the detection of periodontal disease radiographically and clinically. We recognized, illustrated, and showed examples of the classifications, patterns, and distribution of periodontal disease. Lastly, we discussed the predisposing factors that contribute to periodontal disease.
So we hope that everyone at home felt like they learned something about the interpretation of periodontal disease on radiographs.
Tune in next week for our show where Danica will be discussing her drug addiction. Oh, today
No, say that all over again.
I didn't like that hello.
Yeah,
I'm like,
Hey!
I think you guys all should look at the screen.
At the screen,
That's
and
what the
then every now
doctors
and then
would
just
do.
kind of nod.
Yeah, like agree with her.
Yeah, you guys can move around a little bit.
Okay.
Just get loose with it. Just get loose.
Yo. Okay. Ready? Okay?
Yeah.
Your phone is fine.